Heart arrhythmia is a disorder of the heart in which electrical impulses coordinating heartbeats do not work properly. This leads to heartbeats that can be too fast, too slow, or irregular. A heart arrhythmia can come in two different forms: tachycardia, a heartbeat that is too fast, or bradycardia, a heartbeat that is too slow. Tachycardia can come in the atria or the ventricles. There are many factors that can lead to a tachycardia. For example, a person may be born with an extra electrical pathway between the atria and the ventricles that can lead to rapid heartbeats and even short-circuiting. Bradycardia can be caused by a blockage of the electrical pathways connecting the atria and the ventricles, or also by a malfunction of the sinus node, as demonstrated in this image. When functioning properly, the sinus node acts as a natural pacemaker for the heart. This heart has arrhythmia caused by atrial fibrillation, which led to disorganized electrical signals in the heart. An ECG, or electrocardiogram, is a tool used by doctors to display heart rate over time. It can be very useful in diagnosing arrhythmia. This is an ECG displaying the heart rate of a healthy person. This ECG displays the heart rate of a patient with bradycardia. This ECG displays the heart rate of a patient with tachycardia. Symptoms of heart arrhythmia include a racing heartbeat for tachycardia, a slow heartbeat for bradycardia, chest pain, shortness of breath, lightheadedness, dizziness, a fluttering in your chest, or fainting or near fainting. The following factors may increase the risk of developing an arrhythmia: caffeine or nicotine use, congenital heart disease, prescription or over-the-counter drugs, especially some types of cough syrup or cold medicine, high blood pressure, electrolyte imbalance, which can be an overabundance or shortage of potassium, calcium, sodium, or magnesium, thyroid disorders, diabetes, and an excess consumption of alcohol can put you at an increased risk for developing an arrhythmia. While many people with arrhythmia don't even realize it, others require medical attention or even surgery. These are some of the ways that arrhythmia can be treated. To treat bradycardia, a pacemaker can be implanted near the collarbone. The pacemaker has electrode-tipped wires that run into the inner heart. If the heart rate is too slow or stops completely, the pacemaker will send out electrical impulses to stimulate the heart. To treat some types of tachycardia, a doctor may perform what is called a catheter ablation. A catheter ablation is a minimally invasive procedure in which a catheter goes through the blood vessels into the heart. The catheter is equipped with a tip that has the ability to destroy a small area of the heart tissue with heat, extreme cold, or radiation. By destroying the tissue, the electrical pathway causing the tachycardia becomes blocked. A third treatment option is the maze procedure, which is very similar to the catheter ablation procedure previously mentioned. During the procedure, a surgeon will make incisions on the atria of the heart. Because the scar tissue cannot conduct electrical impulses, the stray impulses causing the arrhythmia will cease. This procedure is generally reserved for patients who had already tried both medications and a catheter ablation surgery to correct the arrhythmia. Patients seeking more information about arrhythmia can use many online resources, including the following: Brigham and Women's Hospital, the Mayo Clinic, Eastside Medical Group, and the Cleveland Clinic. I hope you enjoyed this video. I, of course, am Dr. Braga, and these are the sources used in researching for this video on heart arrhythmia.